Hello, everyone, and welcome to today's webinar, Prevention in Action, Addressing a Substance Use Crisis in a School Setting. My name is Orlando Cooper, one of the graduate assistants at IHEC, and I'll be your moderator. I am assisting Madison, the Assistant Director for the Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention, and we are very excited to be hosting today's event. Before I hand over the microphone, I have a few housekeeping items to cover about today's webinar and the GoToWebinar platform. For those of you new to using GoToWebinar, you will see the control panel on the right of your screen. This is where you will find the question box that you can type and submit to at the end of the presentation. All attendees will be muted for today's program, but that doesn't mean you still can't participate. So without any further ado, I'd like to introduce today's speaker, Joe Eberstein. The stage is yours.
Well, thank you very much, Orlando. And I want to thank Orlando and his team, Madison and IHEC, for having me. I think today's topic is very important for a few reasons that I'm going to go over, but I do want to introduce what I do and who I am. So I am based in San Diego County. We have kind of a unique view of the substance use issue because we do share a border with Mexico, and there's a lot of cartel action here with a lot of substances coming across. So we're usually the first ones to see a trend or something else like that happen with a drug. What I do specifically here in this region is I focus on youth marijuana prevention and vaping, but my organization also facilitates the Meth Strike Force and the Prescription Drug Abuse Task Force, which houses fentanyl under it. When I do my marijuana work, I focus solely on youth because here in California, we do have medical marijuana and we have retail sales that went into effect in 2016. If you want to know more about the Marijuana Prevention Initiative, you can visit our website. I do have a disclaimer because I think it's important for all of us to understand why we're doing what we do. This is about public health. I'm here to try and prevent youth from using. We know that if we can kind of prevent use or delay use until the brain is developed, until about 25, that there's a good chance that somebody will not develop a substance use disorder or addiction. I don't think you're a bad person if you have a substance use disorder. I am an alcoholic and I have several alcoholics in my family, and I am not judging you, and I actually think we should be hiring staff that have lived experience because we have a unique view of substance use. This is really about getting the facts to people so that they can make an informed decision. We have some of the worst overdose numbers currently in this country, and actually it should be on the news every single night. We have more overdose deaths than we have suicides or COVID deaths for Americans ages 18 to 45. We have also seen record DUIs, even when we told people to stay off the road. So I think the news and blogs, everyone should be talking about this. This is a national crisis, unfortunately. And that means that it's also bleeding into schools. We have seen an increase in overdoses as schools opened up, and overdoses for things like fentanyl in vape pens and other things. So schools are increasingly ground zero for developing protocols around what to do after an overdose, how to dispose vape pens, prevention activities, having treatment located at the school. And I'm going to go over some of those different trends that we're seeing. But unfortunately, we have seen actual overdoses now at schools, and young kids too, 12 or 13 now. The Surgeon General, for those of you who aren't aware, among the substance use crisis, we are seeing a mental health crisis. And the Surgeon General put out a rare public advisory about the increase in suicide attempts, specifically around adolescent females. In early 2021, emergency department visits in the United States for suspected suicide attempts were 51% higher for adolescent girls. That is a huge increase for the females and a 4% for the boys. So whether it was the lockdown or the COVID or the events that took place in the last 2 years, this is really something we need to get a handle on as well. This affects schools, and I want everybody to be aware of it. As you may be aware, Juul, the company that sells vape pens, one of the ones that started, was aggressively marketing to youth during the early years of Juul, and they were sued by multiple school districts. Finally, Juul is paying some of those settlements. So it is important to know whether or not your school district is one of the 300 that are going to get money. I know in our county, San Diego School District is one of them. They just paid an Arizona lawsuit for $14.5 million. So be on the lookout and ask if your school district was part of the Juul lawsuit. You could be getting millions of dollars. Part of the reason that happened was because of the deceptive marketing practices from Juul. Now, if you remember way back, these vaping devices were promoted as being a way to stop smoking traditional cigarettes. What we know is that most of the people that use vaping devices never actually smoked a traditional cigarette. And what they were doing was so deceptive is they were having people going into schools to go in and say that they were preventing vaping, but all the while they were actually promoting their products. So they were actually going in and telling people how to use their products. And this is kids. So they were also marketing heavily on social media. And we know 10 years ago, a lot of kids were using Instagram and Snapchat. So they have to pay this lawsuit. And you could read some of the comments from Congress in this hearing. This owner was skewed at the meeting, using social influencers on Instagram, marketing candy-like fruity pods to youth, taught students about Juul and vaping products and their risks. But really what they were doing was showing how interesting these vaping devices were. I do want to talk a little bit about marijuana and how we're working with the schools, because marijuana seems to be an increasing topic nationally and in different states. Everybody thinks at some point they're going to make marijuana legal nationally and not make it a Schedule I drug. So I think it's important that each county, city starts collecting data around public health issues related to youth marijuana use. So I want to give you a little overview of what we've seen and what possibly you might want to track in the cities or counties that you are from. I believe Illinois does have recreational marijuana. So there's always a reason. And I don't want to just go into data without talking about why is an individual using. There could be several reasons. It's one thing to point out the substance use, but there's usually a bottom line. Is it trauma? Is it anxiety and depression? There's a lot of co-occurring mental health issues related to substance use. Boredom. Friends may be using. The friends in marijuana is a big thing. You often hear people when they are trying to quit saying, I'm going to lose all my friends, because that may be really the only activity that they all share in common. And I hate to say it, but you probably are going to lose a lot of the friends if you're going to quit. That happened to me with the alcohol. And again, there might be underlying mental health issues, and that's why it's important if you have a treatment facility that you can also have access to a psychologist or psychiatrist. So just remember, we're here to help. I want to know why the person is using and not just talk about the substance, because the why is a big reason in stopping the use. So my big phrase for 2022-23 is abstain and delay. And this is becoming increasingly common, is if we can hold off use in an adolescent until 25 or 26, all of the data shows that they're a lot less likely to develop a substance use disorder and addiction. Now, this is a lot easier said than done because a lot of us are experimenting. And, 25 is right up until the college years. But again, all of the data supports that if you can delay and abstain use, especially heavy use, you're a lot less likely to develop a problem with substances. We also need to battle a perception. And when I hear prevention people always saying a lot of people are using marijuana, everybody's using marijuana, most people don't smoke marijuana on a regular basis. Only about 14% of the nation are regular users. So when we talk to kids and college students, we want them to feel like, they're not missing out. Not everybody is using. Only really a small percentage are using on a regular basis. We know from having, I think it's 5 years now of retail sales, that low potency marijuana is not flying off the shelves at the dispensary. People are not going down to the marijuana storefront or dispensary and purchasing 5% THC. You probably won't even be able to get a product that's lower than 20% THC, which is tetrahydrocannabinol, the psychoactive ingredient in marijuana. We have seen products and we've spoken to owners who say their best-selling product is 86% THC. And it's mostly GMO man-made products, mostly in vapes and oils. I have seen herb strains, which is the herb, the bud, of up to 30 to 35% THC, which is an incredible amount compared to 20 years ago. When we look at the frequency of vape use, there was a really great study that was called the Million Puff Study. So they found that the median number of puffs per day was 132. Now, if you combine that with a vape pen that has over 80% THC and you're puffing 130 times a day, I don't think you're going to do very well in school. And it's unfortunate, again, that people aren't aware as to how many puffs they're taking out of the vape pen. Also, when you vape, you're delivering a higher THC concentration into your bloodstream. So you're getting a more potent high and you're using a more potent substance. And you're using it in a device that's easy to hide and easy to put in your pocket and looks like a pen. There's also lack of any kind of smell and any kind of odor that you would typically associate with marijuana. When we look at our California Healthy Kids survey data during the pandemic regarding use, and I'm sure Illinois has a Healthy Kids data or some kind of a data set that they work on in schools, we have not seen an increase associated with marijuana use. Now, this may or may not be because the survey methodologies during the pandemic were revised. We also had smaller subsets of teens taking the survey. But I cannot tell you in all honesty that we've seen any increases. We haven't. Also, Monitoring the Future, which is a survey that's been around for 45 years, has not seen any substantial increases in youth marijuana use during the pandemic. Now, again, they also collected their data differently during the pandemic. And they had a sample size which was much smaller than they usually survey. So again, to be honest, I can't say that we've seen any substantial increases. I think we're going to have to wait until we get back to normal with the surveys to see what the true impacts of the lockdown and COVID have been on marijuana. We have something called SANDAG, or the San Diego Association of Governments. They put out a great survey that's backed up by a urine analysis of justice-involved youth and adults. And they found that the average age of first use for justice-involved youth is 11. So what does this mean? This means that we need to start prevention efforts and healthy choices campaigns in elementary school so that we can get to these kids before they start using. If you're using at around 11 and you've been using since, up until you're 20, that's 9 years of use that your body has gotten used to the cannabinoid chemicals in marijuana. So it's not going to be an easy withdrawal. Withdrawal from marijuana could take up to 6 weeks. You can see some other data sets for our justice-involved youth. 8 in 10 youth say they have ever dabbed THC. Almost 9 in 10 youth say they've ever vaped. 100% of them say marijuana is easy to obtain. When we look at our treatment numbers, we can see that marijuana is the primary drug of choice for adolescents ages 12 to 17 in our county-funded treatment facilities. And we have seen an increase in females seeking treatment for marijuana. Now, for 18 to 25-year-olds, the drug of choice in our county is methamphetamine. And unfortunately, our meth numbers are not heading in the right direction either. Withdrawal from marijuana is real. Many people don't understand this. It's not something you just quit and in 2 to 3 days you're back to normal. You're going to experience, especially if you're a long-time user, anxiety, depression, sleepiness, yawning, irritability, drug craving. Remember that withdrawal from different drugs is different. Withdrawal from alcohol can be deadly. Withdrawal from tobacco is something. So every drug is different with withdrawal, but it's not easy. And if you've been using for a long time, as I said, it could take weeks to get it out of your system and get all of your chemicals back to normal. The good news is most of the chemicals in your body can reset and get back to normal. We have been tracking poison control numbers. And our poison control numbers since legalization have gone up 75%. Now, this is because a lot is due with candy and cookies and baked goods that have THC infused in them. We also have a lot of marijuana tourists coming to San Diego who aren't familiar with an 80% product. We have had deaths associated with marijuana, and I'll get into a specific case later. But again, this is an increase that we're tracking. And this is why we're looking at increased warning labels, child-proof packaging, and clearly labeling the amount of THC in the product. We have around 37 hospital visits a day in San Diego related to marijuana. Now you're probably saying, well, how on earth is anybody going to the hospital for marijuana? Well, it's things like psychosis. It's things like cannabinoid hyperemesis, the vomiting syndrome associated with people who smoke marijuana traditionally, not vape for a long time, severe stomach pain and vomiting. Because remember, we have cannabinoid receptors all throughout the body and in our intestines. So these hospital visits are also because of accidents, drug interactions. There are over 500 drug interactions between marijuana products, CBD and THC, and over-the-counter medications. So go to a website called drugs.com to see whether or not your medications have a drug interaction. We're also tracking suicides here because we have seen in Colorado and Washington, the numbers of suicides went up after legalization. So in our county currently, according to our medical examiner, that almost 40% of completed suicides under the age of 25 tested positive for THC in 2020. And this is because more research is coming out between the association of high potency cannabis and suicide planning and ideation. The results of the study indicated that even people who use cannabis non-daily were more likely to have suicidal ideation and to plan or attempt suicide than those who did not use the drug at all. So I think if you're going to track marijuana, this is one of the data sets to track. We're also looking at the impact of storefronts on local communities and whether or not these storefronts are complying with the regulations. So 16% of our existing 51 marijuana storefronts are within 1,000 feet of a school or a park. That means that they're breaking the law. They're supposed to be outside of that 1,000 feet barrier. And that's for multiple reasons. You know, kids are very susceptible to marketing and looking at billboards and signage. And we know a lot of poor communities are filled with liquor stores and pot shops and smoke shops, and the kids are inundated with marketing. So we want to make sure that our local storefronts are complying with the rules. I want to get into prevention at schools now with some tools we can use to address what I just talked about. I think this is really important because these are actual tools you can use and develop at your own district or with your schools that you're working with currently or college. You know, we have to get over this assumption that prevention doesn't work. Prevention works. We saw it work with tobacco use. We see it work with health, and we see it work with driver safety. I mean, if I could sum my childhood up in one picture, it's this girl. Both my parents smoked cigarettes. There were no seat belts. You know, I grew up on Long Island with the windows rolled up, and it was either in the summertime with the air conditioner on or wintertime with the heater on. And both my parents smoked Virginia Slims and Marlboro. So I was getting, you know, 2 packs a day as a kid, and then everybody was shocked I developed asthma. My dad also used to drink quite often, the best guy in the world, but this was stuff that I grew up with and I thought was normal for everyone. But prevention does work, it's just how you do it. So first off, if you're running an agency or treatment facility, it is important to hire people with lived experience. You know, we're going back into schools now, and never before have I seen, you know, there's kind of this attitude now where the kids want to see people that relate to them. They don't want to see a very polished individual getting up and preaching to them. They want to hear stories that you've had struggles. So I'm very open about my struggles with alcohol. You know, individuals who are openly willing to share their experiences. They're also good listeners. That's something we seem to be missing lately. We're able to listen to somebody and empathize and have compassion. We also want to make sure that we're inclusive in our work, that what we're doing is inclusive of the population. So make sure that all of our staff is making sure that the language is appropriate for the community, the individuals are, and that we are making sure that the environment is safe for people to feel that they can share their stories. It's never been easier to comment, and I'm only pulling the San Diego agenda for the Board of Supervisors, but all of us now can make e-comments and comment at any city council meeting. And you don't need to go down to the city council. You can e-comment right from your living room. Just know what the protocol is. Because of the pandemic, one of the good things that happened is a lot of city councils will allow you to make a virtual comment. So if you don't like what's going on in your city or county, you can submit a comment or a report or data. Just know what the protocol is and know what the agenda item is on the city council that you want to talk about. There's some really weird type of public health problems that are going on here in California. I just want to bring your attention to, and I'm sure it's happening in Illinois. Because the rollout of recreational use in California was not the best, the state is doing everything they can to promote marijuana, and they're having a competition at the state fair to grow the highest concentration of THC. It is extremely irresponsible that our state is sponsoring this event, and we have spoken at several meetings again about this, how it doesn't align with public health. But just be on the lookout for opportunities to speak when you think that your state or municipality is doing something outside of public health. We think this is extremely irresponsible to be promoting a high potency marijuana competition. And we expressed that at the last board meeting that we had. And then the LA Times put this out: our state fair officials high, they should not reward super potent marijuana. So I'm happy that we were able to speak, and then a nice editorial was printed about it. Prevention dollars, I'm sure that there are prevention dollars going from cannabis tax revenue to schools in Illinois. We in California have something called Elevate Youth, and these are $1 million grants that go back to communities. So be aware of any opportunities there may be for money that is derived from cannabis tax revenue to go back to prevention. They're putting out a bunch of money for capacity building and youth development. And this is strictly earmarked to go to prevention. And I'm sure that Illinois has a similar program. A lot of medical associations are speaking up specifically about marijuana, and I'm glad. More doctors are trying to have a conversation about marijuana with their patients, and more doctors are trying to speak up and come out with position papers like all of these groups. Also, there's a new group that everybody should be familiar with. It's called ISAAC. It's the International Academy on the Science and Impact of Cannabis. This is a non-political group. It's doctors advocating for public health in marijuana policy. This is an ad that they put out in the Wall Street Journal to counter the marijuana industry. Now, they have a webinar series that's free, and if you go to their email listing at isaac1.org, you can join their email listing. It's really great if you have students in school and they want to see a 45-minute to an hour presentation on subjects like psychosis, mental health issues in marijuana, cancer in marijuana, respiratory issues in marijuana, the growing brain, all of those things, and it's completely free. We are collecting DUI data. As I said before, we've had historic DUI deaths in our county, actually 37 to date. As of last year, it was a record number, even though we told people to stay off the roadways. One of the things that our state has not done after legalization was develop a DUI campaign statewide, not only around marijuana use, but around the emerging trend of polysubstance use in car fatalities and crashes. It's not just one substance that we're seeing, it's multiple substances. So this is also, we're seeing pedestrian fatalities. I was talking to Orlando, we have a lot of scooters out here, and people are using those scooters intoxicated, or they're on bicycles and intoxicated, or walking around intoxicated and then walking in front of traffic. So DUI is not just alcohol. There was a report put out by the Department of Transportation. The proportion of drivers testing positive for opioids nearly doubled after mid-March 2020 compared to the previous 6 months, while marijuana prevalence increased by about 50%. And this was when major COVID mitigations began. So again, we're seeing the residual effects from the COVID lockdown, the COVID virus, and substance use. But again, DUI is not just about alcohol. So we have partnered with Vision Zero. I'm not sure if everybody knows Vision Zero is a pedestrian and bicycle safety program. It was developed in Sweden in 1994, and now it's in over 40 communities in the United States. They mostly focus, though, on the built environment and bike lanes, but we are going to be partnering them in San Diego to address DUIs. So we will be talking about polysubstance use, driver safety, and using rideshare programs in developing our own materials. This is our new logo. We're going to have a media event April 29th. It is going to be focusing on several things like consumption habits, over concentration of alcohol and marijuana outlets in communities, product potency. You know, not just marijuana is increasing in its strength, but alcohol products have increased in alcohol concentration. Everybody's drinking those hard seltzers and other things, so the amount of alcohol has also increased substantially. You know, we shouldn't even be talking about DUIs with all of the rideshare and Uber programs, but unfortunately we are, and it's becoming a little bit difficult to get an Uber now in some big cities. But, you know, we have these great programs developed, so everybody should be calling an Uber, you know, after a night of having fun out on a Friday. You know, make sure that you download the Uber app. I want to talk about consumer protections around marijuana, and this is something that you can do in Illinois, but we have had some deaths associated with marijuana. This is a particular individual who was a flight attendant who flew in, I think from the South, and had some gummy bears and then wound up having a seizure and dying. And the family is suing several edible companies because they failed to provide any sufficient warnings as to the consumption of edibles. They gave false dosage limits. They used colorful, kid-friendly, and accessible packaging. They came in a candy, fruity flavor, and they omitted information on individual consumer variability. Everyone reacts differently. So this is causing us here in San Diego to start Consumer Protections Project. You know, if you look at a bottle of aspirin, you can see that there are so many different warnings on that label. I mean, hives, facial swelling, asthma, but you can go to the pot shop and you won't see any warnings around driving. Nothing about mental health, nothing about drug interactions, nothing about respiratory issues. You should not operate heavy machinery, must be over 25. You know, so we are trying to advocate for consumer protections. We actually, there's a bill here called SB 1097, which is currently in the state legislature, which will require marijuana products to have a label that discusses pregnancy, mental health, driving, vomiting syndrome, respiratory issues. We also started a drug interactions project. This is really interesting. I'm very proud of this. We got 17 pharmacies to participate with us in disseminating these info cards with every single prescription they gave out. And it's about warnings around drug interactions. We gave out 10,000 info cards and 2,000 in Spanish. We told people they should visit drugs.com when they're taking their medication to see if cannabis, THC, and CBD interacts. As I said before, there's over 500 drug interactions between THC, CBD, and over-the-counter medications. We also attached a survey to the back of this, which asks patients if they want more information like this. And we've gotten preliminary results. So 40% have admitted to using cannabis on a regular basis. Over 50% were aware of potential side effects, or a little under 50. And over 90% believe patients should be notified of potentially serious drug interaction. So they want more information like this, and many of them were unaware. So remember, drugs.com is a really good website to visit. If you are having an issue with vaping devices on school campus, you should know that vaping devices are considered hazardous waste, and you should not be throwing them in the trash. This means you should have a proper protocol for handling and disposing of these devices. That's because the battery and the cartridge is considered hazardous waste. Now, there's two different things you can do. One is develop a protocol, which we have done here locally with San Diego County Office of Education. And it talks about wearing gloves, trying not to dismantle the device, don't handle with your bare hands. Many substances can be found in cartridges, including fentanyl. And this is a new trend, unfortunately, that we're tracking. We've seen some instances in Connecticut of fentanyl being found in vape pens. So make sure you have a protocol. This, and also take back days are including vape pens. So the next national take back is April 30th. See if vape pens can be taken back. You also have to take into consideration, as I said before, that you can never assume you know what other chemicals are in the drug or the vape pen. And this means that even people who are using, let's say, meth on a regular basis, fentanyl was found along with the meth. And that goes with cocaine, and that goes with heroin. So a lot of time users aren't sure that fentanyl is in the regularly used drug. So handling these, you have to be very careful. They're also starting to charge dealers of substances increasingly facing murder charges. And that's because some people are ending up with an overdose of fentanyl, not realizing that there was fentanyl in the drug that they commonly use. So this is a trend that's taking off nationally. We do advocate for access and use of the overdose reversal drug. And there's a lot of reasons to have this at a school site, especially because we're seeing younger kids dying of fentanyl overdoses. The youngest here we've had in San Diego is 14. There is a package insert that comes with Narcan. You should always call 911. You can repeat the Narcan 2 to 3 times. Several people need several shots of this. I have heard the most of 6 times Narcan was administered before the EMS got to the person. There's other ways of treating people who have substance use disorder, regular treatment, inpatient, outpatient, medication-assisted treatment. Medication-assisted treatment, we have not found any for meth as of yet, but for other substances there is buprenorphine. There's peer support. We encourage people to never use alone so that somebody can administer the Narcan. We also have a naloxone toolkit for schools. You can find this at the County Office of Education website. It gives instructions. We are requiring each school here to have at least 2 Narcan at the school site. And again, this is because of the uptick in students that we've seen, especially with vaping pens, that we don't know what the substance is. We also have teen recovery centers on school campus. This is another thing that's taken off locally. One of the problems in the past was finding transportation for kids who need treatment to go to a location after school. So we just developed, and not just me, but our regional providers, teen recovery centers at the school site. And this is because it's a familiar setting, it's easy to get to right after school, and it doesn't require any kind of out-of-the-way transportation. So maybe you could think about this in your particular community. We are advocating for universal fentanyl testing in emergency rooms. Believe it or not, fentanyl often is not tested at the hospital. There's only the Federal 5 drugs that are tested, and often patients are unaware that fentanyl was a reason for the overdose. So we are actually advocating for fentanyl testing in every hospital. And that is SB 864 here in California, called Tyler's Law. It requires hospitals to automatically add fentanyl to the federal 5 to make it the federal 6, so that people know whether or not there was fentanyl in their commonly used drug. You know, doctors often treat people differently with medication and Narcan if they know what drug it is. So you're not going to administer Narcan for meth. It's not going to work. Narcan is for opiates and fentanyl. So it's good for the doctor to know whether or not there was fentanyl, and it's good for the user to know. We have some school curriculums if you do want to start, if you do want to start at a young age with different curriculums. There's one from Johnny's Ambassadors, and then there's Operation Prevention. Healthy choices are the best for elementary school, not specifically talking about the substance, but just talking about how to say no, not just say no. And also making healthy choices, going to the gym, and doing healthy hobbies. So check these out if you're interested in doing some kind of school-based curriculum. I have to talk about access to phones and the internet while I'm talking about access to substances, because this is a huge problem. When you give a child a phone, you are exponentially increasing access to substances. So I'm not telling you to not give a child a phone or access to a phone. I just want everybody to think about at what age do you think you can give them access? What sites will you give them access to? And what limitations are you going to put on those? Because once you give a child a phone, you're opening it up to all of these issues: body image, pornography, social isolation, gambling, depression, politics, 24/7 bad news, sleep pattern problems, bullying. And I like this comment here at the bottom: are our brains evolving as fast as our technology? And what I see here from the mental health issues and the substance use problems is we really do need to ask ourselves, what age are we going to give these kids with developing brains access to everything? Again, I'm not saying don't do it, but you get a lot of pressure on you if you're a parent to give them a phone because their friends have one. There's also this great emoji code for substance use that DEA put out. So I know everybody uses these emojis, but actually some of these emojis can be deciphered as drug dealing, unfortunately. Some of these innocuous little cartoon characters could mean that there is a drug deal going on, or somebody has a particular type of substance available that they want to sell. There's an enormous amount of drug interactions going on things like TikTok and Snapchat, Instagram. There's a lot of promotion of substances going on there. So again, I would be really vigilant about looking at my child's phone to know what's happening. If anyone is looking for a really great video on the struggles of quitting marijuana, please visit Recovery 2.0. This gentleman here has such an easy way of talking about quitting marijuana and his own struggles. But the reason I'm sharing this is because of the 3,000 comments that people shared about how difficult it is to quit. It's not an easy drug to quit. And you can see if you go through these comments, people struggling. I'm on day 3, I'm on day 30. This is my 4th time trying. I'm trying to quit. So people really are trying to quit. And it's a non-judgmental video about stopping marijuana use from a user's perspective. We have a very active Marijuana Anonymous group here. They actually have a young people's group. It's called Next Step in Life. People often hear about Alcohol Anonymous, but there is a Marijuana Anonymous. And it's great because you can zoom in. You don't even have to actually go to a meeting, and you don't have to share your video. You know, a lot of times I come across, I don't need to go to a group because of marijuana, or I feel ridiculous. Well, go in and listen to one of these groups. They have chapters all over the country. And maybe if you listen to some of these people, you'll say, hey, I can relate to that. I tried quitting 5 times. Or I tried to take a break, for 2 weeks because the marijuana isn't having the same effect as when I first used it. I hear a lot about taking those breaks lately. I have friends that use marijuana. I don't think they're bad people, but I do see the struggle sometimes in trying to quit because marijuana is often seen as harmless. So remember, if anything, at the end of this, you are a prevention resource. If you just listen today and you don't share what you learn or help others or speak at a city council meeting, and then you're just one of these people that's complaining, and they don't do anything, let's try to get out there and help. So take what you learned today, get out there and help. Even if it's submitting a comment about something that you don't like at a city council meeting. Join the PTA, go to a school board meeting, get involved. We need you out there. We have resources. I'm always sharing this link. So everything is downloadable, including our new report. We do TA and technical assistance as well. We have links to the Isaac website. Please join Isaac. It's a great way to educate about marijuana harms. And on that note, I am going to thank everybody and open it up for any questions that there may be.
Thank you, Joe. And as you said, we're open to questions now. We do have one question already. And this question is, are we allowed to get a copy of this PowerPoint?
Of course.
Okay.
I will send it to Orlando right after.
Yep.
I always love having questions because, no question is dumb. So fire away. I do want to say it is unfortunate that we are seeing overdoses, specifically of fentanyl in schools. So if I could leave everybody with, try and have access to at least 2 or 3 naloxone at the school site. There's 2 reasons for that. One is you want to save a life. And the second reason is you don't want to be that school in the media that they come back and say, how come this school did not have any access to naloxone with the current crisis going on the way it is? So look into that.
While we wait on questions, I do want to make a quick announcement that we will send certificates and the presentation along with it in the 7-10 business days. And then we will have this up on our website at IHEC and on YouTube. And tomorrow we will have an evaluation sent out to your email. So please fill that out so that way we can plan our future events a lot better. And it seems like we're not getting any questions. So with that, I might just close the webinar for the day. Thank you, Joe, for
You
your
have my email, Orlando. I want to thank you. If anybody has any questions, that's my email. Feel free to reach out to me.
Have a good day.
Take care.